identifiers. We were very pleased with how this matching process worked. It was a very clean, very easy to match using the Summit County database. And looking at other court systems, it may not always be that easy. Certain identifiers like social security numbers and other important identifiers would be restricted to, you have to get certain research agreements to do those. In this case, we were using a public access interface, and we were able to do this without negotiating a much larger, matching process. Certainly, if it were done on a statewide basis, we would need a system that did everything more mechanically and automatically. In this case, we match data case by case. Because we were just trying to see the quality, we didn't want to send it out to an administrator and say, here's our sample, match it to yours, and give us back your data, and we'll see what's in there. We wanted to see what are some of the problems with using this method. We also then looked at only among the suicide cases, match that to the medical examiner's data to see what are the characteristics of the court involved versus the not court involved. What are some other co-occurring risk factors among those who we found at court involvement versus not? And then also to say, within that population, within the medical examiner's data, a certain percentage would have been reporting having had legal troubles. Well, first of all, did they show up in the court system? And how many more are we capturing in the court data than was reported in the coroner's notes? So it's kind of a sensitivity analysis to see which is the better method. Can you rely on proxies, or is using an administrative source better? Okay, so results, we finished the data, we're looking at it. Overall, the proportion of suicide victims who had any court involvement in the previous year, which would include carryover of involvement from a previous case, so they had another appearance. The offense was actually maybe a year and a half ago, but it carried over into that year. Close to about 38–39% had some court involvement in the previous year. So as a system, it's capturing a lot of folks. Now, the big question is, what do you do? How can courts identify, handle those cases in a systematic way and a useful way for prevention? But just some quick overview of some of the results. Especially for young males, 27% had a criminal charge in the previous year. Criminal being everything from homicide down to a crime for theft, petty theft. But for the young males, 27%, which is a little bit higher than you get as an estimate if you were looking at other sources of statistics. There's been other studies that looked at arrest records and things like that, but none have actually looked at court docket data. It's not that much higher than what you expect. But increased, but we can also look at specific types of offenses. A threefold risk associated with recent domestic violence or sex-related charges. And then multiple offenses, threefold risk factors for males aged 35 to 64. So this a traffic offense and a criminal offense or multiple traffic offenses that some sort of threefold increased risk. This is the one that we didn't quite expect from this data, where the foreclosure had an 18-fold increased risk of suicide. And this is something that is one of those kind of eye-opening things that we just want to look at it further before we publish on it. But suffice to say, a lot of, in terms of the risk, it's a lot, but also the proportion of cases for which they had a foreclosure in the previous year was higher than I would have expected. Roughly 10% of the suicide victims in that period had a foreclosure reporting in the year prior to that. So, as a attributable risk, it's population attributable risk, it's also very high. One thing that's important to note is that this data from 2000 to 2006 predates what we call the foreclosure crisis. And the question is, can you extrapolate beyond those years to future years in terms of the stigma that's attached to foreclosure? So the experience of a foreclosure in 2000 may not have been the same as the experience of foreclosure in 2008, only because of the public perception around it. So if there is this increased risk, would it be the same over time? It's good to see. But it does suggest that it needs to be investigated and look, matching up death records with foreclosures seems like it might be a useful thing to do because it's obviously a problem. Other financial related civil cases also increase risk of suicide substantially, also for women. In a recent auto accident, 3.6-fold increased risk. Recent traffic offenses with a strong spectrum of women, and where defense may be indicative of other things happening in their lives. Women who had recently suicide also have a disproportionate number of traffic offenses. In later analysis, right now we've only been looking at offenses and offensive types as categories. In subsequent analysis, we're really going to start looking at those other court-related stress, so including the length of the court spell related to an initial charge and things like that. This is getting back to that policy question. The policy goal. 17% had court contact in the 90 days. Now again, the study is looking at in the year part, but within the 90 days prior to that, 17% of the sample had a court contact in the 90 days prior to that, compared to 15% for primary care, 9% for psychiatric care, and 8% for hospitalization. So overall, if you're talking about systems that might provide prevention, courts are seeing more than these other systems. Particularly for males, for young males under 35, 31% had a court contact in the previous 90 days compared to 17% with any kind of healthcare contact. So if you're going to put your prevention dollars in a particular place, the question is, are the courts equipped to do that? Healthcare, we know, mental health, we know, has mechanisms in place. Can the courts take on that responsibility? And of those with a recent court contact, 2%. So, we're just comparing 31% versus 17%. Of those with court involvement, less than 2% had any healthcare contact during that same period. Now, some, it may be because they're incarcerated or they don't have access. And that's what they need to look at. But in any case, in those 90 days, which includes a lot of folks who had offenses for which they would not be incarcerated or house arrest or something like that, less than 2% had healthcare contact. So it's a very important comparison we want to look at more. In terms of other characteristics of those with court involvement versus non-court involvement, and this comes back to the data that Valerie and Mark has created. They were more likely to exhibit bizarre or erratic behavior prior to death, which is important because if the courts are looking for ways to handle these cases better, what are the signs? And so if someone's reporting these kinds of behaviors, it might be another sign that the court-involved person this is somebody who's having legal troubles. Other characteristics, more likely to be single or never married, much less likely to have had any psychiatric or medical care contacts. So the court-involved tend not to have overlapping physical or mental health or diagnosed mental health contacts. And also, we're more likely to be strange relationship trouble. And again, court contacts and offenses and offending behaviors may be indicative of other life stressors, including relationship trouble. So to summarize, contact data appears to be a very rich source of data for looking at psychiatric epidemiology issues, including suicide. Courts, more so than healthcare, at least in the sample, are a very important locus for suicide prevention, particularly for young males who aren't being seen in other systems. And the risk we found in foreclosure should receive immediate attention because anytime you see a risk that elevated, and we want to look at our own sample a little bit more, and we're hoping to replicate it in a different state, which has a statewide system, to see if this stands out as well.
That's okay. Okay, folks. I am. Do we have handouts for these folks around here? No. Okay. Well, I'm Carolyn, and I'm the executive director of the Ohio Suicide Prevention Foundation, and I'm going to share with you